guys, Dr. Lavan here. So recently we had 2 patients here at the clinic who had experienced falls at home. Thankfully, they're all doing well, but it did make me think it might be useful to demonstrate what to do if you or someone you live with at home had a fall. Falls are actually an extremely common cause of injury. Around 1 in 3 adults over the age of 65 who live at home will experience at least one fall a year, and about half of these will experience more frequent falls. So if you have a fall, the most important thing is to stay calm. Take time to assess the situation, and if you can take a few minutes, feel if there's any pain or any injuries. What you will do next depends on how hurt you are and whether you're actually able to get up without help. Take a few minutes to check your body for pain or any injuries, and if you're not hurt, try to get up off the floor. If you are hurt or unable to get up off the floor, call for help and keep warm and move around as best as possible whilst you wait. If you're not hurt and feel well enough, you could try to get up off the floor by yourself. The best way will differ from person to person, but as a guide, you can roll onto your side, push yourself up to a side sitting position. Slowly get onto your hands and knees. Crawl towards a sturdy piece of furniture that can support you to get up, such as a solid chair or sofa. Kneel side to the chair or sofa with your strongest leg next to it, and then slide the foot of your strongest leg forward so that it's flat on the floor. Your other knee should remain on the floor. Put both hands on the chair or sofa. Raise and turn your body, pushing through your hands and foot until your bottom is safely on the chair or sofa. Sit for a few minutes before you try to do anything else, and check again for any injuries. Now, if you have weak muscles or painful and stiff joints in your legs, you may not be able to follow these instructions exactly to the letter. Maybe make sure wherever you are, you have a way of calling for help. It's sensible to let the other half or a family member know where you're going. Or if you're with young children, it would be sensible to train your child to access your phone and know how to contact for help. You should call for help if you are hurt, as attempting to get up can make your injury worse. You may also need to call for help if you're unable to get up yourself. To call for help, use a community alarm if you have one. Use a phone to call a relative, friend or neighbour. If you're injured, phone 999 and ask for an ambulance. If you're not sure, call 111. Ask your smart speaker, if you have one, to call someone who can help you. Try shouting or banging on a wall and try to attract your neighbour's attention. Having a community alarm or mobile phone on you at all times will help you to call for help when you need it. Your mobile phone needs to be charged and switched on at all times. A number to call an emergency can be programmed into your phone. Ensuring that a family member or neighbour has a spare key will allow people to get to you quickly. You can also consider leaving a spare key in a police-approved key safe. This is a secure box with a combination lock that can be kept outside your home, which can be accessed by anyone that you've shared the combination lock with. Now, after calling for help, you must keep as warm as possible due to the risk of hypothermia, so try to keep warm. Move onto a carpet, rug or a soft surface. Hard surfaces like tiles or stone floors are often colder and can take longer to warm up. If you have to empty your bladder while you're on the floor, move away from the wet area. Reach for a nearby duvet cover, blanket or clothing that you can use to cover yourself, and move away from areas where there's a draft. Keep your body moving. If, however, you are with someone, ask them to put the heating on and make you a hot drink. You should also attempt to keep your body moving as best as you can. Lying in one position for too long can make you stiff, sore, and damage the skin. Moving your body, even gently, will keep your body warm, focused, and calm until someone arrives. If you can, try rock the body from side to side. If it hurts, stop and don't move. It's important to keep hydrated at the best of times, but if you're on the floor for a long time, it's especially important. If you have a glass or a bottle of water within reach, you can take small sips from it. What I do want to add here is, regardless of whether this is your first fall or you fall regularly, it is important to tell your GP practice or other health professionals, such as a physiotherapist or an occupational therapist. Many underlying causes of falls can be treated or corrected, so don't forget to tell them. If you get a scrape or cut, the flow of blood can make even a minor cut look like an emergency. Minor injuries should stop bleeding after a few minutes. Apply direct pressure for 5 to 10 minutes to stop any bleeding. Wash the wound with plain water and look for any debris. Put an antibacterial ointment on the wound. Cover the wound with an adhesive bandage or other dressings that are watertight and airtight. You should call your doctor or nurse if any of the following occur. It looks infected, is leaking fluid or pus, is red or discoloured, is hot to touch or swollen, or becomes painful to touch. Now, sometimes you can get a strain or sprain from falling. A strain is when a muscle has stretched too far and partially tears. It looks bruised. Pain, soreness and swelling can develop several hours after it happens, so keep an eye on it for these. A sprain is a more serious injury that may include tearing of the ligaments. In a mild sprain, a ligament may be just overstretched. More severe sprains can cause partial or full tearing of the ligament. With a sprain, the injured area usually swells right away. You may be in a lot of pain. Sprains can take weeks to heal and can feel like a broken bone. In children, as they are more likely to break a bone than have a sprain, it is important to seek help if your child is in a lot of pain, especially if it is an area over bone. The signs and symptoms of sprains in young children can be like those for a fracture. They can include pain, swelling around the joint, inability to walk, bear weight, or even use that joint. If you have a sprain or strain, have him or her stop putting any weight on the injured area right away. Follow the RICE rule. Rest the injured part. Put ice or cold compresses on the area several times a day to reduce swelling. Compress the area with a splint or bandage to prevent swelling, and elevate the injured part so that it is above the level of the heart. When treating injuries from sports and other activities, pain medication can be really helpful in relieving pain and reducing inflammation. Paracetamol and or ibuprofen are pain medications that are available over the counter. They are generally safe to use with few side effects when given in the correct dose. Both types of pain medication come in liquid drops or chewable tablets that children can take easily. Ibuprofen should not be given to children under the age of 6 months. Read the directions on the package and don't give more than the recommended dose or give doses too close together. Be careful when giving these medications along with other types of medications. Finally, what I would say is if you suffer a more serious injury from a fall, you must get medical care right away for any of the following. A wound that doesn't stop bleeding after several minutes of pressure, a cut that has ragged edges, skin edges that are far apart or long or deep, redness, bruising, pus or swelling that may get worse, the injured area that feels numb. A popping sound occurs during the injury. This normally means completely torn ligaments. An injured body part that may be oddly bent or misshapen. Any major injury to the head or face. And finally, pain that gets worse if you experience any trouble breathing. It's important to remember that most falls don't result in serious injury. But be assured, doctors will take falls extremely seriously when it's involving older people because of the huge consequences they can have on the general well-being of this group. I hope this video has been helpful, and don't forget, whether you've had your first fall or you fall regularly, it's important to tell your GP and other health professionals. Okay? Great. You take care, and I'll see you next time.